Hi, my name is Tammy Nelson and I'm one of the clinical educators in Central Zone Rural, and we're just going to be doing a little video to review this new inhaler that we've just gotten. It's the Primatene Mist Inhaler. It is not like a normal inhaler, so we're going to review how to use it. This is part of the new treatment of croup. So we're going to be actually referring to this assessment and dosing algorithm for administering aerosolized epinephrine via MDI to children with croup. So this is the algorithm that we're going to be looking at. It's actually going to be inside the puffer with instructions, so it's kind of nice. It all comes in one package. You might actually see on this as well a warning label from pharmacy: do not send this home with a child or to an inpatient unit. So this is how it should be coming, hopefully from pharmacy. And we're going to kind of walk through who gets the Primatene Mist Inhaler. So on the back of the form, the first thing we have to figure out is the severity of illness of the child. So we got to figure out if they're mild, moderate, severe, or impending respiratory failure. So there's descriptions on these of how sick each of the kids is, and so you're going to try and figure out and kind of classify them. If they're mild or moderate, they're actually not going to get any Primatene Mist or EpiNeb. We're probably going to give them some dexamethasone and maybe watch them for a little bit and send them on their way. For the severe patient, we actually will give the Primatene Mist Inhaler. So we're going to start at the top. I guess we should start at the top because that's the very first place we should go. So we're going to do that assessment. If the child is an impending respiratory failure, then we're going to go over and we're going to give nebulized epinephrine. We're going to give 5 milligrams or 5 mils via neb. The reason that we're trying to move away from nebs is that it is an AGNP, so you have to wear your N95 mask during the procedure while it's on. Okay, as soon as it's turned off, it's no longer an aerosol generating procedure, and the droplets will fall and you don't have to worry about being exposed. So we do wear an N95 when we're giving an EpiNeb. If we give more than 2 epinephrine nebs, we should be on the phone with Rapid trying to figure out where we can send this child, where there's pediatric care, because that means that there was significant swelling in their airway, and we want to watch those kids very carefully. If we go down to, is the child severe? If they're not, then that's going to be our mild or moderate, and we're just going to give the dex like we already talked about. If they are severe, then we're going to go to this bottom box and we're going to give 5 puffs of aerosolized epinephrine. Each spray of this epinephrine is 0.125 milligrams per spray. So in comparison, we're giving 5 puffs of the Primatene inhaler, 0.125 milligrams, which is a dose of 0.625 milligrams. So it's a very small dose in comparison to what we're doing nebulized, okay? So how we use the medication's a little bit different, so we're going to walk through that. There is a few things that we just kind of want to note when we're choosing. We are going to use an aero chamber, just like we do for our regular puffers. We want to choose the appropriate size aero chamber, or the appropriate aero chamber for the size of the child. So ideally, any patient that we do puffers for, we want them to be able to use this aero chamber. The reason why is that we lose medication through the mask. So as soon as they're able to form a seal around the aero chamber, we should be moving to this blue aero chamber. So that's usually about school aged, 4 to 5 years old. They can understand how it is to put their mouth around a straw. They can figure out how to do it with this aero chamber. If they're younger than that and they can't form a seal with their mouth, then you're going to go to the yellow aero chamber. This one is a lot nicer to use for, children over the age of 6 months to, 4 years age. You do lose medication through the mask, but this mask is really malleable and you can form it to the patient's face. We do have a smaller aero chamber, which is the orange one, but this mask is really rigid. So I find it really hard to mold it to the patient's face. So when I can, I actually will use the yellow aero chamber. These are $60 each. So if the patient comes in with an aero chamber, you just want to make sure it has all its regular parts. So you want to check to make sure that all the valves are in place. And so today we're going to just show you how to use the puffer or the MDI using the blue aero chamber. So there is instructions on how to do the puffer at the very back as well as at the top of the algorithm. Now this is an off-label use. that we're using this for. So you might not find a lot of information on it on the internet. They have been trialing this at the Stollery and at the Children's, and they've had great success for it. So that's why because it has been expanded provincially. So I'm not going to be using the Primatene mist inhaler because it is very expensive. So I'm going to use just this placebo. And what we're going to do is we're going to have to prime it. So in order to prime it, we're going to have to activate it. Okay, so the first thing we're going to actually do is we're going to shake it 10 times. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. You can also turn it upside down 10 times. 5, 6, 7, 8, 9, 10. Then we're going to spray it into a towel. We're going to repeat 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Spray into a towel. 2, 3, 4, 5, 6, 7, 8, 9, 10. Spray into a towel. And then we'll do it one more time. 5, 6, 7, 8, 9, 10. Spray it into a towel. That has activated it. Now, the next puff you can do is give it into the aero chamber. So you're gonna actually watch for the flap, to make sure that it's actually, they're breathing. You're gonna watch for it for at least 6 breaths, if not a little bit longer. The next one, you're gonna shake it 10 times. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. You're going to waste into the towel. Then you're going to give it to the child. You're going to watch them do 6 breaths. Again, you're going to shake it 10 times and waste it into the towel. So you're going to do that a total of 5 times. 5 doses, okay? After that dose, you're going to wait 10 minutes and then you're going to reassess the child to see how they're doing. If they're still in severe distress, you're gonna do another 5 puffs. You have to reactivate it, doing the 10 shakes and the 4 puffs to get rid of it, to reactivate it, to then do the 5 puffs. So every time that you let the inhaler sit, it has to be recalibrated, okay? The maximum number of puffs you can give is 15 puffs in a 60-minute period, and you're gonna be watching for signs of toxicity. Obviously it is epi, they are gonna get tachycardic, but you wanna watch for excessive tachycardia. So you might wanna throw the patient on the monitor, and also jitteriness is another side effect. So you just wanna watch them for that, okay? The time to watch them for can range from 2 to 4 hours. Epinephrine, again, like we kind of want the dex to kick in to be able to send them home safely. So that's the 4-hour mark. But it's really up to the physician discretion. I would recommend 4 hours, especially in our rural places where patients might be living quite far from where you are. And so it just is higher risk for those patients. So I would keep them a little bit longer. The Primatene does have on it, sorry, it's because it's in the package, it's so very hard to see. It does have a counter on the actual puffer itself. There's 160 puffs in one. It's a 1 puffer per patient. So as soon as you're done with this, it's garbage or discarded. It does not go home with the kid. It does not get admitted with them to the hospital. So you're going to discard it. I hope that was helpful, and I hope you guys have good success for it. And I'm looking forward to using this. Take care.